Good afternoon, everyone, and welcome to this, our fifth of our webinar series all about the prevention of Concordat for better mental health. My name is Richard Taunt.
Chandra Bhattacharya.
Andrew Gordon.
I'm Anna Howells.
And thank you for joining today's discussion, which is going to be an excellent discussion all about leadership and accountability for better mental health. Really pleased that Andrew's here to join us. Spoiler alert, there's going to be a very exciting picture later on. I'm so sorry to ruin it now. But we're going to be talking with Andrew. Hopefully we're going to be talking with Duncan Cooper from Wakefield, technology dependent as well. And we'd really welcome your views, your questions, your reflections as we go through. So just to start us off, in terms of what we are talking about, Chandra, you're going to just give us a brief background to the Prevention Concordat for better mental health.
Sure. Prevention Concordat is a program of support for local areas in their prevention planning arrangements to adopt an evidence-based approach in preventing mental health problems and promoting good mental health. And it also is intended to bring focus on cross-sector working across local authorities, NHS, public, private sector settings, education settings, employers. It also reinforces the increasing understanding that mental health is as important as physical health. And it is also about delivering better mental health outcomes and reducing health inequalities.
Chandra, thank you very much. And this learning event today, is it the only learning event which is going on?
No.
Oh.
I think we are in the middle of our 11, isn't it?
Mm-hmm.
Yeah.
Mm-hmm.
So the next one is in London next week. So we want everybody. We have still a few places. So please, we encourage you to register and attend and cascade appropriately. And we also have these digital discussions, and this is a great opportunity for you to learn, share your experiences, reflect, and influence locally.
Lovely, Chandra, thank you very much. And if you're wanting to sign up for their face-to-face events, to join any of the future district discussions, or to watch back any of the past discussions, the website you need to go to is preventionconcordat.com. Preventionconcordat.com for all of your public mental health learning event needs. Please do have a look at that. So as I said, this discussion today is very much about, well, it is a discussion. So we'd love to hear your comments, questions, reflections as we go through. Anna, how can people get involved?
Yeah, there's three ways you can join the conversation today, either using the question box facility that's on your screens, by email at hello@kaleidoscope.healthcare, or joining the conversation on Twitter using hashtag #PreventionConcordat, and we are at Kscope Health.
Lovely, thank you very much indeed. And please do feel free to put in comments, questions as we go. We're going to hear from Andrew, hopefully, and then we'll come to all of your comments and questions. Please do put in feedback as we go along. I think, without further ado, Andrew, it's over to you.
Over to me. So hello everyone, my name's Andrew and I'm a local councillor in the glorious Republic of Basildon. I am Vice Chair of Housing and Community Committee, so I share a portfolio around housing and community, and I also chair the District and County Health and Wellbeing Forum and Basildon's Health Forum. So I do a lot of meetings. Meeting seems to be sort of like my forte. Got a lot of a good meeting about a meeting.
Is that part of the selection criteria to become a councillor? The desire to go to meetings?
I don't think it's the desire. I can't remember being asked anything about that. So yeah, I'm also a mental health champion, and what that in a sense means is I'm really passionate about mental health. I'm prepared to stand up there and do something about it. And the best way to describe what a mental health champion is to talk about potholes. Now, there's a slide coming up of me staring very intently into a pothole. And you sort of may be wondering, how on earth is this guy going to manage to link potholes to public health to mental health? Well, there is method behind the madness, because my inbox every day is full of people getting in touch with me about potholes, about grass cutting, about curbstones, you name it, I get it in my inbox. And as a local councillor, I'm really proactive, or try to be proactive about responding to those. So I'll have my photograph taken, looking very intently at potholes, being very outraged on behalf of my local community. I'll speak to the local press about potholes. I'll engage the local community and speak to the local community about it. And you know, it sort of forms a central theme in my work. But how often do I get emailed about mental health? How often do I get emailed about public health? Well, the answer is not much. In fact, I can think of, in my 5 years in local government, once I've been emailed by a local resident to ask me what I'm doing about public health and mental health. And I think I want to get in a situation, and I think councillors need to be in a situation where people are regularly contacting them about mental health. People are holding their authority to account. You know, why are you, Councillor Gordon, not adhering to the prevention concordat? Why are you, Councillor Gordon, doing this? What are you doing for mental health and housing? You know, there's a real sort of need for the public to lobby their local councillors more on this issue. And in a sense, that is why the mental health challenge is so important, because it gives a platform to local leaders to say, look, I want to stand up and be counted on mental health. I want to do something about it. I actually want to change things. I think, just to give a little anecdote about how that's made a difference, and how sort of just simply standing up and say you're thinking about mental health has made a difference. So we have loads of committees in councils, you know, loads of meetings, got a lot of meetings, loads and loads of meetings. And pretty much every single committee I go on, officers of the council will know, I will ask them, what impact is this going to have on mental health and well-being? Right? That is something at the start of the challenge, that is something I constantly ask, you know, what impact is going to have on mental health and well-being? And I've done that so much, there's almost been a culture change, because instead of me having to ask now, that impact is automatically considered. And that is huge, because we as a district council in Basildon, we are a district, not a county, we have no sort of statutory function when it comes to health and well-being. But health and well-being, particularly mental health, has a huge impact on our services and a huge impact on our residents. In fact, I would challenge anyone in the discussion to give me one service run by a district council that mental health does not interface with. We have a huge responsibility when it comes to mental health. And by standing up there and asking them that question, what is this policy going to impact on mental health? You know, that's really, really important. And the other thing, and why mental health champions are so important, why local councillors are so important, is we hold the system to account. As local councillors, when it comes to potholes, you know, we'll go to Essex County Council over responsibility. We'll go to whoever, and we will lobby them. You know, if we've got a problem with the hospital, we'll go to the chief executive and we'll shout about it. We're in a really great position to almost be your public health champion. You know, to go around, speak to the people that need to be spoken to, and bring people together to try and do something. But if we're not lobbied about mental health, then are we actually holding the system to account? And if local councillors aren't educated about mental health and prevention, are we empowered to hold the system to account? And for me, the most important part of sort of the public health and prevention agenda is giving local councillors and giving local authorities sort of officers some ownership, you know, and sort of empowering them to actually understand this agenda and get out there and do something about it. And I think also it's about empowering councillors to hold the mental health system to account. You know, one of the things I constantly hear in sort of our town, in our areas, you know, who holds the mental health system to account in our locality? You know, who's driving the strategic agenda? Because you've got the county council, you've got CCGs, you've got public health, you've got hospitals, you've got so many different players, and who's bringing all that together and holding that system to account? Well, I would argue that local councillors, particularly those who are signed up to the mental health challenge, are in a really good place to do that. And all of that is in essence what the mental health challenge is about, and why mental health champions can make a difference, because they do get that empowerment to go around and fight for change, you know, to fight for that culture change that's needed. So I'm sort of going to draw it to a close there, because that may have triggered some potential discussion. And yeah.
Andrew, thank you very much indeed. Just for those who are not aware, and I'm sure people on the line are more than aware, but there's always a chance that people aren't. Do you want to just say a bit more about what the mental health champions as a whole looks like? Yeah, so there's now 100 of us across the country, which is great. We cover district, county, metropolitan. I think we even have a few fire authorities signed up. And every year we get together, so we have an annual meeting. It's sort of run by the Centre for Mental Health. If anyone's interested in finding out how to get involved, get in touch with us and we'll link you in. You sign up to the challenge. You can sign up as an individual member, or you can get your local authority to sign up
to the Mental Health Challenge motion. I believe the website, and someone will have to get this up for me later, is Mental Health Challenge. If you just put that into Google, it will come up and you'll see a little map where all the mental health champions are across the country. They'll link to a portfolio, you can message them there. So if you're sitting there thinking, does my area have a mental health champion? Go to the Mental Health Challenge website, have a look if they do or they don't. And if they don't have a mental health champion, lobby your local councillors. Get in touch with them and say, why don't you have a mental health champion? Why aren't you joining this movement of local councillors who actually want to do something about mental health, who actually want to change the system and try and make it better and try and make improvements? Because local councils are a really powerful force. They can be a really, really powerful force. You know, they're often sort of the roughest politicians because we have that direct interface with the local community. I always sort of like the sort of quote, when local government sneezes, the NHS catches a cold, because it's absolutely true. If we are struggling, then the NHS will struggle too. And local councillors are sort of the champions of that. We hold that agenda to account.
Andrew, thank you very much indeed, and I'm sure we'll come back to potholes and more.
I can't wait
when we get into discussion. Just to be clear, Andrew, if someone does live in Basildon and have a problem with a pothole,
it's not my responsibility.
We're not talking about it today. I think it's the key take home.
If they do have a problem with a pothole, they can get in touch with me, and I'll try and help them as best I can.
Lovely, thank you. But of course, if we want to talk about mental health first,
yeah, please do that before you get in touch about the pothole.
Perfect.
I tell you what, if you get in touch about mental health first, then I'll look at your pothole.
There is a new test. Andy, thank you very much indeed. So hopefully, tech dependent, we're also joined by Duncan Cooper from Wakefield. Duncan, if you're able to unmute. Hello.
Can you hear me?
We certainly can. The wonder of technology. Duncan, thank you so much for joining. I'm going to check first of all, how are the potholes in Wakefield?
Well, I haven't gone over any potholes in Wakefield. Absolutely fine at the moment. I can't count on a future pothole situation though. We'll have to see how the funding goes.
Lovely. Well, it sounds like there's some learning opportunities.
There is. I think I may have to have a chat with Duncan after this. Yeah.
Duncan, thank you so much for joining. Do you want to introduce yourself and your approach to how you've taken forward leadership and accountability in your patch? And you wear a number of hats as well. You might want to talk about those.
Yeah. So I work as a public health consultant at Wakefield Council, and public mental health and suicide prevention is within my portfolio. To help me with that job, I also chair a Yorkshire and Humber-wide group, which is people that come from across Yorkshire and Humber, from local authorities and some from the NHS, to talk about and learn about approaches to the public mental health agenda, crisis care Concordat. It's a CPD network, and we're trying to provide best guidance across Yorkshire and Humber. So I've got a regional hat and a local hat. We've started to try and have conversations locally about what the Prevention Concordat actually means at a local level, and how you get that off the ground and start to galvanise action. I think Andrew's obviously done a really good presentation on why public mental health is important, so I don't think I need to go into that. But I just thought I'd try and feedback on a few of the key issues and sorts of learning that we're getting at a local level today. So I think rather than starting with form over function, one of the things that we're finding at a local level is, in terms of getting local leadership and accountability, the first thing to do is obviously to try and get those conversations going and gather key stakeholders together from right across the voluntary community sectors, NHS, local authority, members of the public and so on. One of the useful conversations that we've having is about how you frame prevention, because prevention is a different thing to different people. Some people, prevention is about recovery really and keeping people out of hospital. Some people it's about primary prevention, stopping people smoking and things like that. But as Andrew said already, what we're trying to do is to broaden the context of mental health so that people don't just think about mental health in terms of mental health providers. So debt management services, community transport for social isolation, tackling bullying in schools, all these sorts of things are preventive services that support community wellbeing and mental health. So those are sort of conversations that we're really trying to have to try and take the Prevention Concordat for something that's specifically just seen as a mental health problem for mental health services. Then the other question that we're trying to tackle is about defining and asking people what it means when things are going well. So the actual outcomes and the changes that they want to see in the community and services that will give us an indication of when the Prevention Concordat is working. So the parity, the STEAM agenda, there's obviously things around people being able to have those conversations and approach the GP and so on. There's the voluntary community sector role and walking groups in the community. That the sorts of people that Andrew was talking about in terms of getting in touch with local counsellors. It's the 5 ways to wellbeing models, some really basic stuff that we're trying to define around what supports Prevention Concordat. I think what's very important is the accountability structure and the lines of communication between whoever's holding the ring around the Prevention Concordat and service users and the public. I think councils are all very different in the way that they engage with the public and they run their consultations. But I think we've got to think really hard about what those lines of accountability are, and it means more than sort of nominal people attending boards and things like that. There's a time for strategic conversations, and there's a time for really getting information from communities about what this will mean to them. So it's that, for me, part of that accountability structure is about having those really clear lines of communication right up and down the system. And then we're supposed to come to the really difficult bit, which is identifying a local leader. The way that I'm seeing this is there may be one local leader who's important as the figurehead. That may be a councillor. If you've got a councillor in your area that's really got that approach and has got the time and the energy and the strategic vision to really take this forward at a local level. But councillors have got all different levels of experience as well and different amounts of time. So I think it's about identifying one person. It might be a councillor, it might be a chief exec, it might be someone, somebody that's got authority locally. But the model that I'm trying to develop locally is one which is more about distributed leadership. So I think as part of that early stakeholders event, you need to find your local leaders in your key issues. So whether that's social isolation, early identification of mental health problems at school, workplace wellbeing, if the Prevention Concordat is going to be successful and really become a movement, I think we need those local leaders in lots of different sectors and potentially one in every organisation. So it's a distributed leadership model. The other thing I think that's emerging locally for us in Yorkshire and Humber, and we had a really useful event a couple of weeks ago with Kaleidoscope, and Richard was there and PHE were there, in that everybody sort of intrinsically gets the Prevention Concordat because everybody understands the link between mental well-being and so many other things and assets of life. But the difficulty people are having is with that domain 3 translating need into deliverables. So I think that as part of those early discussions with stakeholders as well, you need to take the evidence and triangulate that with what the local appetite is and what the local priorities are, and really give people a short list of the sort of things that they're going to be able to work on and what everybody agrees are the things that are really going to improve mental health. Some of them might be doers straight away, others might need to go on the shelf for a year or two until the funding comes along or the appetite comes along. But I think that having a relatively short list of key priorities is absolutely essential, because the public mental health and suicide agenda is huge, and I think we can get too sidetracked by thinking we've got too many priorities. So I think that's inevitable. And then I suppose the final thing that we're coming across is funding will always come up early, and it will come up consistently throughout these discussions. Everybody feels the pressure on funding. So I think it's about, and again, I think Andrew made a really good point about this. I think there's different ways we can think about funding. We can influence money that's been spent elsewhere, and obviously Clinical Commissioning Group and NHS England will have the majority of the money that's allocated to mental health services. So it's about how we put that preventive approach and join up those services and get small VCS organisations involved. So that's the first thing. It's about influencing other money and spend, because we're not going to get additional money to double fund things. And then secondly, it's about recognising where we spend a huge amount of money on mental health and protective factors within social care, resi care, drug services, debt bereavement services, benefit services, education. The council, if you think about the way that mental health is divvied up, all that prevention is really going on within councils already. So we have to think about working across the piece within our local authorities and with our VCS about those organisations that are already promoting mental health. So I think those are the main things for me. It's very tempting, I think, when we start thinking about the Concordat, to think about all the other strategies that we may have dementia strategies and social isolation strategies and so on at a local level, and we can start drawing lines between strategies, doing pretty pictures, drawing up big action plans. But I think the basics, the sort of things that I've just been talking about, are really important. So we've got the function first, and the form can follow after that. One thing that I heard at a recent event about this as well was that someone said you can't do everything. It's a marathon, not a sprint. And I think, and I personally have to hold back. I get very impatient about things, and I'm thinking about this more as a 5-year plan now. The Prevention Concordat, if successful, I think is going to be a movement rather than something that's just a single 2 or 3 year plan. And I think we have to start thinking about long term. Some things can go on the shelf for a bit and may come up later, but it's going to be a movement. And importantly, with that short list of priorities as well, it's about using the local energy that you've got in the room, in the council, in the local area. We can't do everything at once. So I think in terms of the translating these into deliverables, we have to pick 5 or 10 key things and then just really go for those. I think that's all from me. I think the key thing for me is about distributive leadership. It's about getting people to lead on individual areas, not being overbearing with huge action plans, letting them get on with it and do what they think and what they're experts on.
Lovely. Duncan, thank you so much. A really articulate description of your work in Wakefield. Thank you very much indeed. So before we just go on to discussion, just a reminder about how you can join with us this afternoon. Anna.
Yeah, so 3 ways to join, either using the question box facility that should be on your screens via email. So you can email us hello@kaleidoscope.healthcare, that's the one, or on Twitter using #PreventionConcordat@KScopeHealth. And all those details should be on your chat box facility as well.
Anna, lovely, thank you very much. So we'd love your questions for Duncan. For Andrew, Chandra, you said you're particularly keen for very difficult questions. So if anyone has anything particularly about, I don't know, PHE funding formula or something, yes, that would be great. Look forward to those. But your questions for our fantastic speakers, but also any sort of reflections on your local practice as well would be fantastic. We've got about half an hour or so for discussion. So if it's okay, I might take Chair's prerogative. And start with one, and I'll go to Andrew first, and then to Duncan. Your pothole image is really powerful.
Apparently it is.
because actually it is something which sort of, as an ordinary voter you can relate to and you can understand. What do you, sort of taking Duncan's point about this is marathon, not a sprint. What do you think it will take to change the culture of that relationship between voters and councillors, so that it may not be parity of esteem between potholes and mental health, but actually there is.
I'd love to see the government document parity of esteem between potholes and mental health. That would be interesting.
Forthcoming. But how can that cultural shift happen so that more people go to their councillors?
I think that's a difficult question to answer, and I don't think there is one single sort of nice package answer. And if there is, please let me know. Because I think it is a long journey. I think the public are beginning to or the general public as a whole, are starting to take the mental health agenda a lot more seriously. I think that has helped because there's a lot more discussion about it out there. People are raising issues of concern, people are, bringing it forward. But I think ultimately it's, for me, and just, purely anecdotally, it's about what mental health is. I think sometimes people can see mental health as a mental health hospital, where all the mentally unwell people go, and they get given medication and they're whacked back out in the community. I think there needs to be more sort of a movement to see mental health more as physical health. We all have a mental health, we all have a physical health. And I think when people start seeing mental health as what it is, mental health, not mental illness, I think that's when people say, well, actually, my housing has an impact on that. My financial situation has an impact on that. The local community park, that has an impact on that mental health. So I think when we start to see more and more discussion around mental health as a concept, and more understanding out there about what mental health is and how it affects every single one of us, not through the lens of mental illness, I think then that's when people start making the link. And I think councillors are really in a really good position to be ahead of this agenda and actually be able to sort of, if we take the learning around this, to actually take this learning on board and actually be ahead of the public. And know actually what to say when people start championing this forward. So yeah, I think it's a long journey. I think it is a marathon. a very long marathon. But I think that, I said, when the general public starts seeing mental health more as mental health and not mental illness, I mean, that's when us as counsellors will start seeing much more attention drawn to what we're doing. I also think there's little things that can be done as well around that. So often counsellors will get big, large documents when they're deciding on whether they want a planning application done, whether they want, certain policy decision made. Then just a little note in that policy document that says, what is the impact on mental health? What is the impact on the community's mental health? Just a little box that's, that's including the impact assessment that specifically asks that question will actually trigger a discussion. And I think little things like that can sometimes be sort of underestimated, but they're really important.
And starting sending that signal that this is something which should be considered more than it
well,
is.
absolutely. I mean, because if you think about it, one of the big challenges at the moment in local government is sort of funding and finance, and we're having to make really difficult decisions about what we're spending and where we're spending it. And actually, we're looking at, how if we make it. So if we're spending, if we as local government are spending on a service and we're investing £10, but we're only saving £5, it's not making sense for us. But the NHS may be saving £20 or £30. So actually, there's a conversation that needs to be had around that. So if the NHS, if local government is investing £10 and the NHS is saving 30, but we have to close the service because we've got no money, then where are the NHS going to pick up that tab? So there are some systemic questions around funding that need to be answered. I think the other. I've slightly jumped onto funding, but
let's come back to funding. I'm sure we can have a good discussion.
Yes,
and Sean, it'd be good actually just touching on other vitals. Let's come back to other vitals in just a second. But Duncan, how does the world look in terms of that sort of conversation with the general public about the importance of prevention of mental health problems and promotion of good mental health look like from Wakefield?
Was the question specifically about with counsellors, or was it the general public? I didn't hear it that well. I'm sorry.
It's because I just waffled, Duncan, mainly. But I think an interesting dynamic between the relationship between the general population and counsellors, but also the salience amongst general population of public mental health issues.
Yeah, I think in terms of working with counsellors, one thing that I've found useful in engaging counsellors is how important the suicide agenda is within this, because I think when we use terms like public mental health and prevention and things like that, I think it can get a little bit confusing, and in terms of talking to the general public and with the counsellors, but the suicide prevention agenda is something that everybody intrinsically understands, because it's the main cause of death for adults under 40. Local communities are devastated by individual suicides, and for every suicide that you get, there's another sort of 25% or so that are unreported. There's an estimate to be 40 to 100 times numbers of people in the community that have had suicidal thoughts or self-harmed. And then for every person that kills themselves, there's obviously the family that is devastated as well. And I think the suicide agenda and the things that you put in place in the community to try and support people to come out and talk about mental health, and when they're heading downhill and they're going into that spiral, to put in that safety net so that they can talk about it with their mate at the library, down the pub, wherever, is really, really important. And I think we've got to sort of harness that. I think people think too much about suicide as the individual tragic events, but I think that that's practically a really useful agenda for us to get some good conversations going. It's a very difficult subject to talk about, obviously, but I think that's probably quite a useful one. The other area for me is, and when I talk to people about mental health and talk to members of the public and groups and councils and so on, is I think I'm going to go along and talk about mental health services, but I start talking about debt and poverty and social isolation and things like that, and then you start to have those really interesting and rich conversations about what modern life is like for some people, and people start talking about zero contracts, juggling 2 or 3 different jobs. You hear it from families that are considering going to food banks for the first time in their family history, and about what that means to them and how that affects their mental health. So I think we've got to sort of always think about those social determinants of health as well and how that links into mental health. I think that's a really good way. And then the other thing I think is about with stigma is trying to demystify mental health. And I think there's two ways that we can do that. There's all the campaigns that are going on about people just talking about the mental health and that getting more into sort of general currency and parlance, and it obviously helps when you've got celebrities in the paper talking about that. But then there's the practical things, and this is where I was talking about like champions and leaders in different areas. Andrew mentioned the parks. We've got a local project going on where people in recovery from mental health services locally in Wakefield are going working with park managers and so on in parks within Wakefield District, and there's just been some absolutely amazing results. It's just been fantastic to see how much that's improved recovery, and also how much that's improved people that previously didn't really talk to people that they considered to be mad, in terms of understanding what mental health issues were and understanding that there aren't dangers in this, and just getting to know and talking to people. So it's about getting those little connections going as well. And I think those sorts of things are really good practical ways of really getting the message out around mental health, that it's just another aspect of life like physical health.
Duncan, really nicely put. Thank you very much indeed. Anna, we've got questions coming through.
We do, and thank you very much for those who have sent them through so far. Please do feel free to keep them coming. Just touching on your point there, Duncan, about language around how we talk about public mental health or prevention. Mike asks, to help change the culture and really get buy-in to the overall ethos of prevention, we may need to change the word mental to emotional, and he'd be interested to hear your views on this.
Great. Should we take that one first, then come back for more?
Yeah, another one after that.
Duncan, your take, and then we'll go to Andrew.
Yeah, I think that's a really good point. I haven't got an answer to that. I mean, in mental health or mental well-being or just well-being, or happiness are words that we try and use much. I think one of the criticisms that I've heard of public mental health work has been that we're trying to medicalise everything by saying everyone's got a mental health problem, which I don't think is true. But I take that sort of criticism on board in that mental health services seen more as a medical model. I think emotional that's a really good point. And I was at a conference recently where Dr. Rory O'Connor from Glasgow University, is worth looking up. He's doing research about what are the emotional factors that lead people up to suicide and self-harm and things like that, and what are the things that if you take a sample of 1,000 people with depression, 98% of them will not try and take their life and 2 of them will. And why do they do that? What are the emotional factors? And the things that are coming out for men are things like feeling trapped, feeling embarrassed, humiliated, those sorts of things. And these are all emotional responses to things. So I think that's a really useful point and an interesting way of thinking about things. And the other thing that they're interested in research is young people and what leads young people to take really drastic action within their life and self-harm. And they find that these emotional factors can escalate really quickly over a week or two. So somebody that could seemingly have no symptoms or no outward signs of emotional distress can, over the period of 2 weeks, that can escalate very, very quickly to attempted suicide. So I think, I'd be interested in talking more about this, because I think as we start the work with the Prevention Concordat, and as I was saying earlier, get those lines of sight and communication out into patient and community groups, finding out what does engage people best. I think the emotional aspect is really, really important.
Okay. Thank you. Andrew, so emotional rather than mental, how do you, if someone does contact you about mental health issues, what language do you use? Other than thank you.
I mean, politicians have to be very careful about the language they use, because language has power, particularly when you're thinking about anti-stigma and things like that. I think for me, I always use mental health. I stick very much with mental health and mental illness and sort of draw out the two and talk about the differences. But it is feelings, isn't it? It's how we emotionally relate to the world. This is what this whole agenda really is about, how our emotions affect our everyday life. And if our emotions stop us living the life we want to lead, then actually I'd say that's a mental health problem, and the intervention is needed. So I think language is always important. It's always important to reflect on what language is being used. But personally, I have no sort of real preference or strong feelings either way. I just think it's always important to tease out whatever language you use, to tease out that difference between mental health and sort of the emotions we have and feelings and mental illness and mental health conditions.
Andrew, thank you very much. And this point about language, I think it's Mike, thanks very much for the question. Point really well made. And if you joined a few of these webinars, I think it's a theme which does come back time and time again, particularly how you use the right language to work with the range of different audiences who are crucial to the success of any strategy to improve mental health outcomes. Anna.
Yeah, on to our next question. Thank you, Adrian, for this one. So Adrian asks, Duncan spoke about the need to pin down a small number of specific interventions. So how do we see this happening? Will PHE wait for a consensus to emerge, or will it guide the consensus?
Adrian, really good question. And this point about is there a list? Is there a small set of things which just everyone should be doing? Is one which comes back time and again. Chandra, it'd be great to get your view, but Duncan first. If PHE came out and said this is what everyone should do, just do it, would that be a constructive thing? Would that be helpful, or how would that go down in your patch?
Yeah, it's really difficult, that one. I think PHE have veered away from trying to produce a short list of things that we should definitely do. I think that prevention concordat will be different in every area. I think there's lots of evidence-based interventions around mental health that give good return on investment and really improve people's lives. The planning guidance and the evidence reviews that you've got on the PHE website around Concordat, I've got lots of those in. So I think it's about, and you can look through those, and there'll be lots of different things that you can do that are potentially useful. As I said before, I think it's about seeing what the appetite and the energy is locally, because I don't think there's going to be the resources to do everything. So I think it's probably about picking some key things. It will depend on the population as well. I mean, older people's social isolation might be a bigger particular issue. Debt and poverty is a big area that we're concerned in locally in Wakefield, and that's just because that's what we're finding in families in Wakefield. But that might not be the case elsewhere. So I think you have to sort of do a standard public health needs assessment and see what the key things will be locally. So look through the evidence. Get you if you're working within a public health department, I'd sort of look at getting a long list on what you think you should be doing, and then triangulate that against what's possible and where you can get support from the local leaders and potential funding, and then that will sort of be able to narrow it down. But I think, as well as thinking about interventions, I think it's worth thinking about settings as well, and however you want to do that, but thinking about across the life course approach and thinking about what your key settings are and where your key areas are to actually influence. So whether that's schools, workplaces, Job Centre Plus, there could be some really good pearls of work that's going on already that are key settings for which you're going to be able to deliver some really good mental health interventions. So it's about being sort of quite pragmatic and looking across your local patch as well.
Duncan, thank you very much. And a really nice point in there about having a really clear understanding, assessment of your area's needs. Chandra, PHE view. So PHE have steered away a bit from saying these are the must-dos. Yeah. Do you want to talk about sort of why that approach has been taken, sort of what resource and support there is?
Because, for example, I sit in the national team, and it's the local areas who have the better understanding of the local needs. So it's for them to decide what it is. And as Duncan clearly says, that it is those interventions has to be meeting the needs of those local people. For example, there could be underrepresented population who are at high risk of mental health problems. It can't be an universal recommendations from us. So we are only there to provide. We have loads of resources as part of the Prevention Concordat, as Duncan mentioned some of them already. Planning guidance, we have local examples. So it's good for local areas to look at those and tailor it to their needs. And if you're doing a needs assessment, maybe doing consultations with your citizens and your population, maybe doing both a quantitative and qualitative review of what people want, what their needs are, and then developing those, and maybe use our resources to look at best practice examples, because ours are all evidence-based. So we have looked at, evaluated them. So there are good examples that meet your needs. So we don't have that local knowledge. You are experts in local knowledge. So we we can't tell you what to do. We can only guide you and give you sets of interventions which are evidence-based.
Lovely. And to mention that ROI tool, which we
ROI
touched on.
tool, yes, we have return on investment tool. It's one of the, I think, most downloadable return on investment tools of all PhD return on investment tools. It's widely used. And I am not a health economist, so I shouldn't be saying much, but it's a very good, and I think as Andrew had mentioned and Duncan also alluded to, is it's looking at the whole system. So who is investing and where are the returns? So you need to think about that. And public health interventions, looking at primary, secondary, tertiary prevention, and the impact could be longer term. And whoever has invested, and it could be the returns could be realized in a different part of the system. So you need to look at a system-wide approach when the investments are happening. So it has to be a joint discussions of what is happening.
Sandra, thank you very much. I know, and I think Adrian's come back. It would be great to get Andrew's view just on this debate. It's a fantastic debate.
Yes. So Adrian says the concern is that local councils won't approve new things. They feel safe following the herd, and if the herd doesn't get started, perhaps nothing will happen. But then I'd just be interested to hear, Duncan, your point earlier about kind of distributed leadership, and whether that's kind of the answer. And Andrew, I guess in your role as a mental health champion, kind of leading the way.
Lovely, Adrian, thanks so much. So Andrew, to start, would it be grease to your elbow if national government came out and said, look, local councils just need to do stuff?
No, we don't like being told what to do by local government, by national government. We get very sceptical. Like they're telling us to do something, but actually, I think one sort of thing, and just picking up Adrian's point about following the herd, district councils and, well, local authorities across the country tend to be quite competitive. If, let's say, Wakefield are doing something really well, for argument's sake, Wakefield are doing something amazingly, and Basildon's not, and I know that, me as a local council will say, well, why is Wakefield getting this? Why is this happening for Wakefield, and why is it not happening in Basildon? So I think sometimes public health practitioners could unlock that spirit of competitiveness in local authorities. And the way we did that in Essex was really simple. We just had a map, right? We got a nice big map of the county, and we agreed on a list of things that we wanted to do. The areas that did those things were highlighted in green. The areas that didn't do those things were highlighted in red, right? Within a couple of years, you saw all the map green, because councillors want the best for their local community. And if they see red, it's not good, and that means that we're letting down our residents, and our residents can grill on that. So, I mean, never be afraid of fostering that competitiveness. I think local councils and local authority, I think following the herd, I think yes and no. I think yes, there is comfort in sort of the system and sort of, doing things in the right way, but each council will like to do things their own way. And I think if you know your local area, you can pitch it in a way that's sort of the Basildon way, the Wakefield way, the Thurrock way, the London way, It's just sort of using politicians and using the way they think to your advantage.
Lovely, and thank you very much. Duncan, coming to the point, going back to your earlier point about distributed leadership, have you seen signs of this taking root in Wakefield? Are there sort of actions which you're seeing happening now, which possibly weren't happening before, which you think is good evidence that this approach is starting to happen? Or are we at too early days for that?
Yeah, it's quite early days, and we're starting to see some good evidence that some of our campaigns are taking root in the community. Like we wanted something around our community anchor organisations or sort of local centres for voluntary work, and we've got a 5 Ways to Wellbeing campaigns that are starting, and I'm just starting to see things appear and leaflets come out, and the way that they're structuring the whole way that they're trying to support local people. It's been quite interesting seeing how that's taken off, because when I see something happening that I've not anything to do with, that's what gives me the sort of most hope that things are going to work, that we've got a message that people have taken on board. So I think that's the case, and we've certainly started to when we set up our public mental health group, and only 3 or 4 people came to start with, and it's standing room only now, and we're getting people that are coming along and want to go off and do, or can I go and do this in schools, and saying things like that. I've got this really good idea, can I go and do this? And we're not trying to, I mean, as long as it's sort of fairly evidence based and it's got the support of the room, we're just really been quite light, I suppose, on governance around it. So that people are going off and starting to do things now around social isolation as well. I think it's starting to happen, but it's still, we still haven't got something that I can hold up and say, this is our prevention concordat, this is our agreement. I think we're still a way off that. But a lot of the things will have been happening already, and it's probably about sort of harnessing a lot of that existing energy and putting things together. But I think it's still early days. I mean, it takes a long time to get these sorts of things going if you want to sort of try and form a movement. What I didn't want to do was, with the crisis care concordat, that was a much more directive piece of government policy, I think, and the people put in place plans at a local level, and that was really structured. What I didn't want to do was to have a big sort of crisis care concordat approach where we have action plans and people doing specific things. I want to spend a little bit longer seeing what the appetite is for the prevention concordat and what people think are the key priority areas really before we start going off and putting rings around it and making action plans and things like that. So still quite early days, I think. But I think something, I don't know whether you're planning on doing this, Richard, but it's about these sorts of webinars and having, blogs and places that people can exchange ideas about what is working and what isn't working locally. They're going to be absolutely essential, I think, carrying on. We're planning something locally in Yorkshire and for later in the year about, prevention concordat a year on, those sorts of events. It's not going to be as everyone said, it's not going to be an easy task. It's more of a marathon than a sprint. So things will happen slowly, and it may be that if things really work well, we're not going to, we just won't know what's going on. It's about community action, isn't it? There's no way that you can accurately record that in every single part of Wakefield, every single part of London and Essex. It's about people going off and doing things off their own bat and feeling that they're empowered to do that and having a common sense of objectives that they're working to.
Great, Duncan, thank you very much. Well, I think in terms of the power of these webinars, I've already heard a blossoming rivalry between Basildon and Wakefield, which I'm sure it's going to run and run.
Absolutely. It's all about collaboration rather than rivalry.
Collaboration and competition can coexist. Let's not set them up as dichotomy. Anna, further questions?
Yes, we do. Thank you, Mike, for this one. So Mike asks, he'll be interested in views to understand how we can embed mental health prevention and interventions across the system when the system is concerned with things like hospital admissions, for example, within integrated care organisations or accountable care organisations in the future.
Lovely, really good question, Mike. So that sort of that how can mental health prevention of mental health problems be embedded within those big NHS reform areas? Andrew, do you want to start?
I think that my initial response to that was don't stop banging on about it. Go to the chief executive, go along to the CCG board meeting and ask them what they're doing. As a local councillor, and as a local councillor, you can do that. You can go along and meet with your chair of the CCG and say, well, what are you doing? I think it's just about making sure that all these various meetings that take place, there's someone there who's banging the drum. There's someone there who's saying, what are we doing about mental health in this? Where's this going? Where have we looked at mental health prevention in this? No matter what area it is, that question needs to be asked, because that's I think how you go about sort of embedding it. It gets people thinking, we haven't thought about mental health. When we're reconfiguring the hospital and A&E, have we got a little side room for people who've got, mental health? Little things like that are just answered by asking that question, what about mental health? There's so many different forums that people can go to. You've got your CCG board meetings, various STP footprints will be, have loads of meetings. You've got council meetings. The members of the public can ask questions at a local council. Just write in a question. You can lobby your MP. There's so many different avenues that people can take this to really sort of get that conversation going. And so it gets to the point where people don't have to be asked, and they just naturally produce what is going to be the impact on mental health and well-being.
Andrew, and there's a really nice point made at our last face-to-face learning event when we were in Nottingham about that banging on, not just finishing when you see words on a page, but actually this isn't. I think the phrase used was, this isn't fit and forget. You just need to keep on. There's something really.
I sound like a broken record, but I don't care. It's because it's such an important issue, and we're not there yet. So the more broken records we have, the ultimate goal is to eliminate the broken record. So you don't have people like me going around saying, "What about mental health?" Because it's already there. It's already done, and we're already sort of on the way to that journey. Maybe I just like the sound of my own voice.
Well, what's your role again? You're a politician. No, let's not go down that track.
It's a dark place.
Yeah, Duncan, integration with ACOs or ICSs, as they're now being called, or STPs. Your experience?
My experience, and I don't know who asked that question, but I feel their pain because I've had difficult issues as well with this. I think you've just got to remain eternally positive, and as Andrew says, just keep banging on about it. Focus on the sort of long term in terms of things aren't going to happen immediately, but you've got to get your seat at the top table to be heard to start with. So it's about sort of using what local leaders and influence you've got to do that, and just there will always be something in strategies in STP mental health plans and ACOs and so on about involving the community, involving community services and prevention, which very often they're in there, but they sometimes get ignored a bit. So you've just got to keep holding people to account and pulling those out, and at every single meeting saying what's happening about this and trying to move things along incrementally. Because in all the national strategies, the 5-year forward view has got prevention all the way through it. We've got national strategies around suicide and like 4 national reports from the Health Select Committee on that. So we've got national, and you'll have local policy to back it up. But as you find that things do automatically get sucked into the acute sector sometimes. So you've just got to keep doing it and think about it in terms of small steps. I think it's very difficult. And then there's some, practically we're trying to do it as well in terms of mental health services. Our local mental health trust has got a really good recovery college, which is about people with mental health issues, their long-term recovery, and getting them involved in, physical activity and learning and lots of sort of things that supports their mental well-being. So you've got to get involved in those things and try and broaden the scope a bit. My question to the Recovery College locally is, why wait for people to get mental health issues before you start doing all these practical things in the community? Can we try and do that to stop people actually having to get admitted to hospital in the first place? So I think there's just there's a sort of different things that we can do, but it's the local suicide prevention strategy that we've got in West Yorkshire. It's a really good example of probably a strategy that within public health we felt wasn't strong enough in the prevention element and was geared towards the main secondary care providers. But 5 people from different areas have been going along to that meeting talking about prevention. We keep saying the same thing. 3/4 of suicides in people that haven't been to mental health services. That's about a really broad community approach, and the message is getting through. It's taking 6 months to a year, but we're starting to get some really good results now. So I think it's just about what Andrew's saying, just banging on, keep saying the message, and remain positive about it. And I think we will get there in the end. It's not going to be easy, but you've got to keep going.
Okay, thank you. So again, a common theme in all of these sessions is the importance of persistence, tenacity, getting back up when you've been knocked down, and having that positive outlook. And that's come through on a range of different occasions. So I think that point really well reinforced today. And we're almost out of time. Thank you again, everyone who's joined. What I think has been a really great discussion, particularly Andrew and Duncan. What we're going to do just before we close, we're going to go round. I'll just ask everyone here and Duncan on the phone just to give sort of one key reflection from the session. What I'll do just to buy people time. So I will start and go to Anna, then Andrew, then Chandra, and then Duncan to close, and then we will finish. So I think that the key point for me was that debate we had about should PHE sort of prescribe a sort of list of national actions. I completely see where that view is coming from, but there's something so important here about local ownership of action. And if we're seriously talking about leadership at that local level, having that process of deciding and owning what those priorities are, I can't see how you get round that. That's my takeaway. Anna.
My takeaway is probably the points around the importance of identifying local leaders and encouraging distributed leadership, so that you can let different people lead, and this can really turn the prevention Concordat into more of a movement.
Thank you very much indeed. Andrew.
I like, just piggyback, I like that sort of, it is almost a movement, and it sort of has the characteristics of a movement where people are having to be tenacious, having to be dogged about pushing this agenda through. I mean, the take-home message is don't give up. because through in these sessions, through talking to colleagues, you can actually see that things are moving and things are changing. So even if you're sitting there after the 50th email, you know, about commissioning a recovery college, you're pulling your hair out, you know, you're fed up of attending your CCG's board meeting, that tenacity is so important because it ultimately makes a difference to people's lives.
Lovely. Chandra?
I would say it's about raising awareness and advocacy about wider determinants of mental health, what we discussed, and that is crucial in making the leadership into account, holding them to account.
Lovely. It's not just about services. And Duncan, we hope we haven't stolen yours. So quick thinking if we have.
I'd agree. I'd agree with all those comments about leadership. I think in addition, it's just about having a really clear vision. Think about a few key outcomes, a few key things that you want to do, and don't get sidetracked by thinking that you have to do everything.
Lovely. Duncan, thank you very much indeed. Thank you again, everyone, for joining. Just a quick run through of the events coming up. So the Prevention Concordat bus rolls into London next week. We're then in Plymouth, Birmingham.
Red.
It's got no claims painted on any side of it. London, Plymouth, Birmingham, London for Cambridge. That's a rearranged date for the eagle-eyed amongst you in April. There are 4 more discussions. Anna, next discussion.
Yes, the next discussion is on the 8th of March, again 1 till 2 p.m. and this, very excitingly, is one of our viewers' choice webinars. So if you have any ideas for topics that you want us to talk about or want us to focus on, do let us know and get in touch.
Lovely, thank you. We're close to finalising what those are going to be. So if you've got a burning topic for discussion, it's not allowed to be potholes. I'm really sorry. If you've got a topic for discussion, get in touch. We'll be confirming those in the next couple of days. To say again, thank you for joining. This session's being recorded, so it will be going up on that preventionconcordat.com website following today. So please do share it with colleagues who would find it useful. Thank you very much, everyone. Thank you, Andrew. Thank you, Duncan. Thank you, Chandra. Thank you, Anna. I hope to see you on one of these calls again in the future. Thank you very much. Goodbye.